Hello everyone, I am Dr. Santosh Kumar, orthopedic and joint replacement surgeon based in Kolkata, and I head the PUVA International Orthopedic Foundation. The purpose of this foundation is to bring the world-class orthopedic surgery, orthopedic treatment at the most affordable prices right here in Eastern India and right here in Kolkata. We welcome all of you to come and avail our services, whether it be people of Bengal, other people of Eastern India or Bangladesh. You are all welcome to come and avail our world-class orthopedic surgery services. So in our past educational videos, we have been discussing various hip, knee, spine problems, and today we will be discussing foot and ankle problems. Hip and knee, we have focused a lot, we have discussed a lot, and we have made many videos in which you can see you can find your queries regarding to the hip and knee problems. But foot and ankle is something which has been less visited, and there are a lot of people who are suffering from foot and ankle problem, and they have been suffering silently. So let's focus our attention to the foot and ankle problems and let's solve them too. As you know, ankle joint is one of the most important joints in our body. We walk on the ankle joint, we walk on the foot. Just as hip and knee is important, similarly foot and ankle is also important. So this is the structure of human foot and ankle. So what is ankle? The place where the leg bones and the foot bones join. That joint is called ankle joint. So on top of this is the shin bone called tibula, that is the thicker bone. There is a thinner bone called fibula. There is a thick bone called tibia, and this joins with a bone called talus, and there is a heel bone called calcaneum, and there are multiple other bones which we will see subsequently. Now these joints function in a tandem. They work and supplement each other in the movement. So these joints are joined by something called ligaments. These are the ligaments which join the joints. Like this is something called talofibular ligament, the most common ligament involved in ankle sprain. The talofibular ligament which joins the fibula with the talus bone. Talus is the bone which forms the mortise of the ankle joint. So this is the commonest ligament which is involved in ankle sprain because of an eversion injury. The foot twists like this. So this ligament gets injured, and along with that there is another tendon which is very important, the source of pain, that is Achilles tendon. Achilles tendon is the tendon by which the calf muscles join the heel bone, which is known as the calcaneum. So this tendon is something very important, and we cannot walk till this tendon produces the ground reaction force. So how we walk? We push the ground and the ground pushes us. That's by Newton's third law. That's called ground reaction force. So this tendon produces that ground reaction force, and this Achilles tendon is very important for walking. This may be injured, this may be ruptured, and then it has to be resolved, otherwise it's a big issue. So there are multitude of muscles which pass through the tendons and muscles which pass through the ankle joint. These are the retinaculum. This is the extensor retinaculum. Retinaculum means it's a bridge sort of thing underneath which the tendons glide. What are tendons? Tendons are the cords of muscles by virtue of which the muscles attach to the bones and they produce the movement at the joints. So these are the tendon, multitude of tendons in the front, in the back, and these attached to the various small bones, and this produces a synchronized movement of the foot and the ankle. So these muscles are something very important, and they are affected in many problems. And the most common diagnostic study that we do to see the ankle joint is an X-ray. A simple X-ray can show all the joints, and indirectly it can show some other ligament and tendon issues also. Simple X-ray is sufficient to show an advanced arthritis too. But along with X-ray, if we want to focus more on the soft tissues like the ligaments and the tendons, or if we want to see arthritis at an early stage, we have to go for an MRI. MRI is a magnetic resonance imaging. We all know that, and by that slices we can see all the bones, the ligaments, and the early affection. We can pick up issues very early in MRI. The ankle fractures are something very common. Ankle fractures involve the foot and the ankle joint, and they involve they may be medial malleolus fracture, lateral malleolus fracture, based on the pattern on which the foot twists at the time of impact of force. If somebody falls from ground, it can be a calcaneal fracture. So there are multitude of fractures, and these fractures can be medial malleolar fracture, lateral malleolar fracture, bimalleolar fracture. There can be syndesmotic injury. Syndesmosis means the two bones, the tibia and the fibula, are connected by a short of ligament, that is known as syndesmosis. And this can be trimalleolar fracture, in which the posterior malleolus is also torn. So multitude of injury patterns are seen, which are mostly high velocity injuries, or it can be a twisting injury which affects the ligament and the bones along with it. So we see all these injuries in X-ray. If in need, we do a CT scan and MRI, and we fix the fractures. What we do, we fix the fractures. Whatever fracture may be, we fix the fractures. Now, what are the symptoms of ankle fractures or injuries? There is pain, swelling, lack of movement of joint, and most importantly, there is inability or extreme difficulty in standing and walking. So these are the issues with ankle fractures, which can be either ankle fracture or there can be ligament injuries. There is pain, swelling, deformity means there is deformation of the joint, there is inability to weight, where a person cannot stand and a person cannot walk. So these are the issues with ankle fractures. These are again seen in MRI. If they are seen in X-ray, it's well and good. These are seen in MRI. The commonest fracture is something called bimalleolar fracture or a trimalleolar fracture. Like this is a fracture wherein the ankle joint has fractured. This is the thick bone, this is tibula. It has fractured at two places. One is medial malleolus, another is posterior malleolus, and the thin bone called fibula has also fractured. So this is trimalleolar fracture, in which all three malleoli have been fractured. So these are fixed in OR. We fix with multitude of plates. There are many plates and screws. We fix it under fluoroscopy. We see this is an image which has been taken under fluoroscopy. When the surgery is under progress, it is fixed with multitude of bone and screws, and that's called open reduction and internal fixation. We try to get anatomic reduction as far as possible. We try to get an anatomic reduction so that person has no residual disability once the fracture heals. So this is of paramount importance to get an anatomic reduction. Now, along with injuries of ankle joint, we see multitude of cases, several cases of arthritis at various foot joints. Like foot joint or ankle joint is not one joint, it's a series of joints. The ankle joint is formed by the tibio-talar joint, then there is subtalar joint, there is calcaneocuboid joint, there is talonavicular joint. So multiple joints are there. Like we see in X-ray, this is the ankle joint which is formed by the tibia and the talus. Then there is subtalar joint. So all these joints have movement in them, and the final movement of the foot and the ankle is a synchronized movement of all these joints, and all these joints can get affected by arthritis. So what is arthritis? Arthritis is the wear and tear of the joint. Any joint is formed by a cartilage between two bones. Any joint is a junction of two bones wherein there is a cartilage and there is a lubricant fluid. So once the cartilage wears out, bones start rubbing with each other. That causes pain, and all these joints can be, the foot joints are all small joints, even hand joints are all small joints. So there are a series of joints which can get affected and produce pain. So this, for example, in this X-ray, the subtalar joint had got affected. Now, when we talk of big joints, like we have continuously talked of big joints like hip and knee. So whenever a hip and knee gets affected by arthritis, the joint gets destroyed. We have seen in all our previous videos that has been replaced. It has been replaced. We do hip replacement, we do knee replacement. So the standard treatment of big joint arthritis is replacement. That's the standard treatment for big joint arthritis. Once we come to smaller joints like foot and ankle joints, and foot and ankle joints are different from hip and knee, not only because they are smaller, but they have less muscle cover. So in these joints, we do not go for replacement, we go for fusion. So what is fusion? Fusion is wherein the cartilage, the burnt out cartilage between the two joint surfaces, bony surface, taken out, and it is fused. So this gives complete pain relief first, and this gives correction of deformity, that is the disfiguration of the foot is corrected. So deformity is corrected, complete pain relief is achieved, and there is stability. Any arthritis causes pain, instability and deformity. So these are the three features of any arthritis: pain, deformity and instability. So just as joint replacement corrects this, joint fusion, which is technically known as arthrodesis, also corrects the same. So in foot and ankle we go for joint fusion, arthrodesis. Now you may think that if joint is fused, how will it function? Well, as I told you, it's a series of joints in foot and ankle. So if we fuse the joints at functional position wherein a person can walk, run and do his or her all activities. So there are functional positions in which it is fused, and it's a series of joints. If one joint is fused, the other joint takes more care of the movement. So it's like that. And in this X-ray we have shown something called subtalar joint fusion. This is the talus, this is the calcaneum. In between that, arthritis has developed. We have removed the cartilage surfaces, put bone graft and fused with screws. So when it comes to ankle joint, unlike hip and knee, we do not go for replacement in every cases. Rather, in ankle joint, arthrodesis or fusion is the treatment of choice. This is a gold standard treatment. And this, whatever reason may be, if ankle joint is destroyed, the ankle fusion or arthrodesis is the gold standard treatment, and there are various ways to achieve it. So basically, what is arthrodesis? We remove the worn out, burnt out cartilage, we fuse the joints and we fix it with some metallic fixation. So this is arthrodesis. So what are the indications of ankle arthrodesis? Indications of ankle arthrodesis are painful range of movement, deformity, instability, which can be occurring because of arthritis, because of injury, because of infection, because of tumor, whatever reasons it may be. The ankle joint can be fused for all these pathologies, for all these problems, and that is known as ankle arthrodesis. This is a model of a foot and ankle joint. So this is the thick bone or the tibia, this is a thin bone or the fibula, and if you see from behind, this is the ankle mortise, which is formed by the talus bone. This is the talus bone. So this is known as tibio-talar joint, that is the ankle joint. And beneath the talus bone, this is the heel bone or the calcaneus, and there are multiple other bones like talonavicular, calcaneocuboid, midfoot. So this portion is known as hind foot, this is known as midfoot, and this is known as forefoot. So these are the three areas of foot. So ankle fusion is something which involves the tibio-talar joint. If it is involving the calcaneocuboid joint, this is the calcaneocuboid joint, arthritis involving calcaneocuboid joint, then calcaneocuboid fusion is done. If arthritis involves talonavicular joint, then talonavicular fusion is done. So these are the multiple ways of fusion. And then there is something called triple arthrodesis. One of the commonest problems, one of the commonest issues in foot that we face is a flat foot. Flat foot is good normal variant, nothing to worry about till it becomes arthritic. Like if after a certain age, if after several decades, if it becomes arthritis, if it arthritic, that is there are arthritic changes in the joints, then triple arthrodesis is done for flat foot, which resolves the problem of pain and corrects the deformity of the flat foot. So that's also what is done. So these are the types of ankle fusion: calcaneocuboid, midfoot fusion, subtalar fusion, talonavicular fusion, and triple arthrodesis. We will see subsequently. Ankle arthrodesis is the commonest fusion that we do. In ankle arthrodesis, it can be open arthrodesis, it can be arthroscopic arthrodesis, and it can be ankle arthrodesis can be included with tibiocalcaneal fusion. Mostly it is associated with tibiocalcaneal fusion also. So the commonest way of treating ankle problems, resolving ankle problems, is ankle fusion or ankle arthrodesis. And presently one of the most successful ways to do it is with arthrodesis nail. Like this is a nail, this is a titanium nail which is put retrograde. That means it is put from beneath the heel, it goes up, and then there are screws which fuse the joint. So this fuses the talonavicular joint, calcaneal joint, and these are the screws which aid in the fusion. The joint cartilage is removed with a saw or burr, and then bone graft is put, and this is what is done. This is fusion. This is ankle arthrodesis or ankle fusion. Similarly, selective fusion between the talus and the calcaneum joint can be done. So this is the joint between the the talus and the calcaneum, and it is fused with multiple screws and bone graft. So this is selective fusion. This is known as subtalar fusion, the fusion between the talus and the heel bone, that is the calcaneum bone. So this is known as subtalar fusion. And then the commonest, one of the commonest arthrodesis that we do, fusion in foot that we do, is triple arthrodesis. Now why triple arthrodesis is important? Because it's the end stage treatment of flat foot arthritis. Flat foot is quite common. Most of them are asymptomatic and it's okay, nothing to do with it. But if it turns arthritic in later on in age, then we do something called triple arthrodesis, in which three joints are fused: the subtalar joint, the calcaneocuboid joint, and the talonavicular joint. So these three joints are fused, the cartilage is removed, and wedges of bone are resected in such a way to correct the deformity. We do preoperative planning by templating and then we fuse it. So this is known as triple arthrodesis. It can be done arthroscopically. Talar joint fusion can be done through arthroscopy also by putting multiple cannulated cancellous screws. So these are the ways in which it is done. And we also have something like we replace hip and knee. Similarly, we have ankle replacement also, that is known as ankle arthroplasty, in which there is titanium on two edges, and in between that is ultra high molecular polyethylene, very similar to the way hip and knee joints are replaced. But ankle joint replacement or ankle arthroplasty is not that successful as ankle fusion. Ankle fusion is more successful, more predictable results, more reproducible results than ankle arthroplasty, and presently we do more of ankle fusion rather than ankle arthroplasty. Similarly, another example of selective fusion is talonavicular joint. Selectively the talus, this is the talus bone and this is the navicular bone. This is a midfoot arthritis. So these are fused by this bone graft and screws. Then presently we have something called plates. We use plates for midfoot fusion. This is midfoot. So midfoot fusion can be done with plates, and these plates achieve very good fusion. Similarly, we have calcaneocuboid fusion. In which the fusion is done with a specially designed plate. So these are all types of midfoot fusion. So what we learned is that foot and ankle is an important issue. It's an important source of pain when it comes to walking in various individuals, especially the seniors. And there are multitude of treatments selectively fusing the joints to get rid of pain, to restore stability, and to restore the congruity and the shape of the joint, and to reduce the deformity. So if you have further queries, you are most welcome to ask me on my WhatsApp number 9831911584, or you can mail me at sintdr@gmail.com. Thank you.